Hello, I'm Dr. John Sweetenham, the host of the ASCO Daily News Podcast. Hurricane Helene made landfall on September 26th in Florida and raged over parts of Georgia, North Carolina, Tennessee, and Virginia. The disaster has claimed over 230 lives, many people are still missing, and many thousands are homeless. The hurricane has exacerbated the nation's IV fluid shortage, and some healthcare facilities have begun implementing conservation strategies. Meanwhile, Hurricane Milton, another powerful hurricane, is expected to wreak havoc as Florida braces for back-to-back hurricanes in parts of the state. On today's episode, we'll be discussing the impact of these events on cancer care, including the shortage of IV fluids. Joining me for this discussion is Dr. Mary Jennifer Markham, a professor and research lead for the University of Florida Health Cancer Center's Gynecologic Cancers Disease Site Group. I'm also delighted to welcome Dr. Julie Gralow, the Chief Medical Officer at ASCO. Our full disclosures are available on the transcript of this episode. Mary Jennifer and Julie, many thanks for joining us for the podcast today.
Thanks for having us, John.
Yes, thank you.
Mary Jennifer, can you tell us your exact location today and how your patients and institution have been impacted by Hurricane Helene so far?
Yeah, so I am in the north central part of Florida. I'm in Gainesville, Florida, which is the home of the University of Florida, where I practice medicine. And we are physically about 2 hours north of Tampa, 2 hours north of Orlando, and about an hour and a half southwest of Jacksonville. So right in the middle. And we are currently in the track for the next storm. Helene was really a devastating storm. And what our area felt was primarily what we tend to get in most storms here in the center part of the state, which is a lot of rain, high risk for tornadoes, and a lot of power outages. And one of the challenges that my center in particular faces, and some of the local cancer centers and cancer care providers around in our region, is our patients live in a very rural population. So for those patients who are not in downtown Tampa, downtown Orlando, for example, the rest of the state, especially in the northern part, tends to be quite rural. And so many of our patients had loss of power, and a lot also in those regions are on well water. And so when the power goes out, it's not just a matter of losing air conditioning and losing access to Wi-Fi, but it's also losing access to fresh, clean water.
Wow, it sounds very challenging. And of course, there are growing concerns at the moment about the IV fluid shortage that's being caused by Hurricane Helene. And some hospitals have already begun conserving IV fluid supplies. Can you tell a little bit about your experience with IV fluid shortages so far, and whether you are anticipating other medical supplies to be affected by these shortages in the days or weeks ahead?
Well, the IV fluid shortage has definitely impacted us. I happened to be on service last week and this week, and working in the inpatient setting right now on our oncology inpatient service. We are having to conserve all IV fluids, and the entire hospital has been directed to find workarounds. And it's not always easy to find workarounds. It has definitely impacted our ability to safely discharge patients and to sometimes adequately give people the hydration, for example, that they need. You know, a lot of the cancer therapies, we also use intravenous fluids to pre-hydrate or post-hydrate. And it's a challenge when we also need to conserve those IV fluids for other critical needs in the hospital setting. And for me, the shortage is really being felt in that inpatient setting right now. I think that other centers are still going through. And what we learned from the pandemic is that when there is a shortage, and it's not just actually the pandemic that we learned this from, but from any of the supply chain issues that we've had, is then centers start buying it up. And so there's a bit of a panic in the healthcare field where if we're short on IV fluids, then well, now everybody's buying up the remaining IV fluids. And I think that does impact, unfortunately, everyone in a negative way.
Yeah, I was reading some news reports earlier today, actually, about stockpiling and the efforts that some of the companies are going to control their outward-going supplies to hopefully prevent some of that stockpiling. As if life for you and your patients wasn't difficult enough, you now have the prospect of another major storm Hurricane Milton, which is headed your way and predicted to be among the most destructive hurricanes ever on record in Central Florida. What are your major concerns in the days ahead and for what this might mean for the longer term impact on cancer care down there?
It's concerning. We are definitely in the path, and the hospital is currently in crisis preparedness mode. My concerns are always for the patients and for the teams caring for them, especially in my current work in the inpatient setting these last 2 weeks. Our patients, because they come from such rural areas, are going to lose power. We will probably lose power, but we have generators at the hospital system, so we're a bit protected. But in many of these areas around us, there will be high winds. There will be flooding for those along the coast. And just the access to a clean, safe living environment is going to be in jeopardy during and after the storm. What concerns me about our patients in particular with cancer are the ones who are undergoing treatments and who may have complications and may not be able to reach the help that they need during the storm or in the days following. I have patients that I've been caring for in the last week who still haven't recuperated, still haven't recovered their power from Helene. And so this is just adding insult to injury. I think that the impact on medical supplies is still to be seen. The challenge is always when a storm wipes out the major manufacturer of a particular product. I think we'll probably continue to have the IV fluid shortages. And I think it's just going to be a matter of preparing for a worst case scenario, but being prepared.
Absolutely, yes. You've already alluded to the fact that as each of these successive disasters affect the country, we sort of learn a little bit more each time. And ASCO has provided resources on its website for disaster assistance. We'll share a link in the transcripts of this episode to connect providers and patients to the Hurricane Helene specific resources, government agencies, and also to patient and caregivers. Julie, as ASCO's Chief Medical Officer, you've been speaking to stakeholders across the oncology community, as well as many groups that are responding to the crisis. What's your message to ASCO members and patients and caregivers today?
Our main message at ASCO to our members, our immediate outreach was, we're thinking of you, we're here for you, let us know how we can help you. As you've already said, we've learned from past natural disasters. We had Katrina way back when, specifically for the IV drug shortages. We had a shortage back in 2014 due to a problem in Norway. But in 2017, we had another hurricane, Maria, which impacted Puerto Rico and majorly impacted IV fluid. So we have knowledge that we've gained. We as the whole medical community have gained on how to adapt and where we can hydrate orally or, give electrolytes and where we can reserve things. I think one of our main messages at ASCO is that while our members are those who treat patients with cancer, we use IV fluids everywhere in the hospital, the operating room, the emergency room, the ICUs. We are all in this together. And so while we have some specific things related to oncology where we can probably save fluid and conserve, et cetera, we need to work as a whole team, a whole body to protect each other. So if you're developing an incident management team at your institution or whatever, it needs to be multidisciplinary. We all need to be protecting each other's patients as well.
Yeah, absolutely. Just on the subject of IV fluids, do you think it will be necessary to mitigate the IV fluid issue by bringing IV fluids in from other countries?
I think the full impact, how long this is going to be, how much we can ramp up domestically is really yet to be seen. We're all looking at this. So Baxter, which supplies about 60% of hospital IV fluids and end peritoneal dialysis solutions, it was flooded essentially at their big plant in North Carolina. They have several other plants in the U.S. and some internationally too. So the question will be, did those other plants also make IV fluids? Can they be ramped up? There are at least 2 companies in the U.S. that make IV fluids. What will be their ability to ramp up? Baxter says they've already I think Mary Jennifer alluded to this. They've already instituted a mitigation strategy where they're placing products on a protective allocation. They are really trying to protect against stockpiling, et cetera. So the FDA has come out and said it will consider reviewing potential temporary imports. It also is looking at expediting reviews once the manufacturing lines are up and going again. It will expedite those as well. And they're looking at alternative providers. IV drugs are officially on the FDA's drug shortages list, and that allows certain flexibilities, I am told, in terms of, for example, being able to make sterile IV fluids at a local site if it's on the FDA drug shortage list. And there's some other things that go along with it. It's really hard to find on the FDA drug shortage site. You have to use the right keyword, which would be, you have to look it up under sodium chloride for injection or dextrose for injection. You can't look up saline on it, but it is now there. I think it just got placed in the last 24 hours or so. And so that does allow some additional flexibilities.
Okay, great. Thank you. So a question for both of you. A couple of years ago, we covered the consequences of Hurricane Ian on this podcast, and Helene and Milton will presumably not be the last storms which are going to disrupt cancer care and undoubtedly cause a great deal of hardship to many people, both our patients and those who are giving care. Climate change probably predicts that this is going to be an ongoing event, and these events have undoubtedly tested the disaster preparedness plans of cancer centers in the region. I wonder how you would assess the readiness of cancer centers to respond to these big disasters, which are undoubtedly in our future, and what areas of care do you think would need more attention? Mary Jennifer, maybe I'll start with you for that question.
I think cancer centers working within their health system really should have disaster preparedness plan in place. Here in Florida, I am very used to the preparedness plans that my system has developed really for every hurricane season. And because hurricane season is from June to the end of November, we are fully aware of this plan and can start taking action. And a lot of that deals with, when do we close particular clinics? What areas do we need to prioritize? How do we make sure we've got proper staffing? I think that is the type of thing that cancer centers should have really in a written protocol. You know, here's what we do when this news is coming out of the weather center or something along those lines. One of the challenges that we face, and I think probably this is, I guess I'm going to speak for all of the Southeast who is in the hurricane risk area, is disaster fatigue. And I think that is I don't know if it's unrecognized. I fully recognize it because I feel it. I think earlier when we were talking, you mentioned Hurricane Ian, and I don't even remember Ian because we have so many of these hurricanes. Every year there's a new one or multiple, and they all seem to bring the same kind of disasters, usually on a local scale. I think what we've seen with Helene has just been so massive across multiple states. But the fatigue, that's disaster fatigue, I think can lead people to become a little lax. And there is a risk, I think, of caregiver. If we think of all of us as caregivers for all of our patients and for the physicians and teams practicing, it's easy to become numb and tired and worn out of preparing for these disasters. So I think it's very important that this stays top of mind and that centers are preparing and also cognizant of the fact that fatigue is also a real potential.
Right. Thanks. Julie.
We learn from each event, and the events have come closer and closer, at least the hurricanes have. I totally agree with Mary Jennifer that we can't have disaster fatigue. Each one does have its unique component. For example, Helene, while we could see the past and it didn't stray that far from its past, did we really expect that this region, this Appalachian region, would be the one most impacted? They're nowhere near a coast. You know, it was a bunch of flooding and dams breaking. So each one is different. From ASCO's perspective, we've learned and we've developed both a domestic crisis response team and plan, as well as an international one. And it's besides hurricanes and major storms, we've had fires and earthquakes. And for our international crisis response team, we've been dealing with conflict and getting cancer care delivery in regions of conflict. So by having a team formed, by learning from each event, and then quickly communicating with members when we can get a hold of them on the ground as to what the real situation is and how we can help, I think we've gotten stronger over the years. It's still, with each one, it's horrible for the people on the ground. And our job really is to best support our members and their patients as they're trying to get their lives back together.
Thank you. So I think that winds up most of the issues we wanted to cover today. And I wanted to thank you both, Dr. Markham and Dr. Gralow, for being on the podcast today and sharing your insights on what is, of course, an extremely challenging situation. I should remind listeners that they will find links to disaster resources for providers and patients on the ASCO website at asco.org. You can also follow Dr. Markham on X. Her tag is @DrMarkham, where she has been sharing key information and resources. And Dr. Julie Gralow will continue to share resources on X, and you can find her @JRGralow. We want to wish you, Mary Jennifer, and our many colleagues in the affected regions all the best during what we know are very challenging times.
Thank you.
And thanks to you, Dr. Gralow, for sharing your insights and thoughts with us today as well.
Thanks for having us, John.
And thank you to our listeners for your time today. If you value the insights that you hear on the ASCO Daily News Podcast, please take a moment to rate, review, and subscribe wherever you get your podcasts.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.